So we are going to write 3 paragraphs. We are going to write 3 paragraphs. Okay. Now, you can see here. So we have medications, family background, nursing management and progress during hospitalization. This is discharge plan post. Okay, discharge. So what is required? Okay. You have to notice these things. Right. Right. Now let us see what are the different things that you can consider here. So you see, monitor medication compliance, blood sugar level, alcohol intake, dietary regimen, encourage, suggest establishment, encourage establishment of social activities. Okay, till here, and an overall lifestyle plan, involvement in community social worker. Okay, so all these things after discharge. So this you can write in the last paragraph. You can write in the last paragraph because you are writing this letter. You are writing this letter to the community, okay, health center. Okay, you're writing to the community nurse. You're writing to the community nurse. Fine. So this is post-discharge, what they have to do. Fine. The next one, during hospitalization. This is during hospitalization. What happened? Right. So admitted. So she was admitted. Okay, she was admitted. So first one is admission stage. So admission stage, you can say, right? Upon admission or so why she was admitted and all these things. And what is the treatment given here? Okay, nursing management and progress. These 2 things you can take. Then you can write about her personal history, social history, or whatever you want to write. You can write about social history, personal history, right? Then afterwards you can write discharge plan. So this you can write in the, okay, let us see here. This you can write main body paragraph, okay, MBP 3. This is main body paragraph 3. You can write in the last paragraph, okay? And yeah, so this is about her, okay? You can write about her and her habits, okay? And her income and other things. So this is all these things will go into this body paragraph. Main, okay, main body paragraph 2, you can say, okay? Family background, all these things can go there, right? Then, so this nursing management, okay, this can go into main body paragraph 1, main body paragraph 1, okay? So main body paragraph 1, 2, and 3, okay, and 3. Then here, so medications. So having cleared these things, so main body paragraph 1, you'll write about upon admission what treatment is given and all the other things you can write. You can write all these things. Okay. Yeah. Next one. Second paragraph, you can write about personal background, habits, social background, retirement, all these things you can write. And third paragraph, Okay, after discharge, what he has to do. Okay, so this is something like present, complete, and future. This is present, and this is complete story, and this is future. So this is the way how you can divide. Right. Now let us see what you can write. What you can write in there. Fine. So here she was admitted. First stage is admitted. So this one, she was admitted here, nursing management progress since admission. Okay, now you can talk about this one, admitted. Okay, on 14th April 2017. So you can start with this. Right. So admitted, admission. Okay. First admitted, only admitted. No need first admitted, it's just admitted. So second admitted, third admitted is not there. So just admitted and then discharge, finish. Okay, admission, admission date and discharge date, that's all. So 14 April 2017, that's the thing, 14th April 2000. So you can start with on 14th April 2017, Miss Cartwright was admitted for what? For stabilization of diabetes mellitus. Okay, for stabilization of diabetes mellitus, that you can write. Okay, so for this one, what was given? So how you are going to write this one is very important. Okay, how you are going to write this one is very important here. So let us make some points here. So what are the points that you can use? So admission. So you can take admission. You can take admission here. Number one is admission. Then after admission, what you can write? You can write for what purpose he was admitted. Okay, for stabilization of diabetes mellitus. Okay, stabilization. Okay, he was advised for stabilization. Admission was for stabilization. For what? Diabetes mellitus type 2. Okay, T2DM, diabetes mellitus. So admission. Then next one, treatment for this one. So what is the treatment for this one? What is the treatment? Treatment was given. What are the treatments here? Hypoglycemic agents. Okay, right. So hypoglycemic agents, you can see there. Medical hypoglycemic agent, glibenclamide. Okay, right. Glibenclamide and then metformin. Glibenclamide and metformin, you can take them. So glibenclamide, GLIB and glibenclamide, and then metformin. So you can take those things. Glibenclamide and metformin. So those are the two things here. Yes. Anti-glycemic agents, glibenclamide and metformin. These are the two things. And that is for how many years? Okay, you have to see how many years. Now here it is 9 years, non-insulin dependent. Okay, so this is for 9 years. Right. Yeah. Then next. Right. Then in addition to this one, you have one more problem. What is the other problem? Now, small ulcer. This is small infected left foot ulcer. This is another problem. So this is the second point. First point is unstable diabetes mellitus. This is point number 1. So this is treatment for, so point number 1. This is for type 2 diabetes. Yeah. So that is number 1. Okay. Admission number 1, stabilization. Okay. Next, number 2. Number 2 is ulcer. Ulcer. So you can say that as 2. So you can talk about this one. Ulcer. What you are using for ulcer here? It is you are taking this augmentin duofort. Augmentin duofort. Augmentin duofort. Augmentin duofort. You're taking augmentin duofort for this one. This you can write in the second sentence. Okay, 2 sentences. First, you talk about the main thing, that is unstable diabetes mellitus, and second one you can talk about ulcer augmentin duofort. Right. The next one. So these are the 2 sentences you can write. And then what next you can do is now here. So these are the medications, augmentin duofort. Okay. Augmentin duofort. Now here, yeah, review at completion of course. See here. Here, medical hypoglycemic agent to continue, and antibiotic therapy for review at completion of current course. This is review is there for this one. That is continued, and this is, there's a review at the completion of, so antibiotic therapy. This is it. Okay. Antibiotic therapy for review at completion of the course. If it is fine, then you can stop. It needs further, so you can continue the medication. So review is required. So that you can write here, but review. So, okay, third sentence, continuation of this one. Third sentence, continuation. So review of the same. That what is it? Augmentin duofort. Okay, augmentin duofort. Okay. At the end of the course, review at the end of the course. Review at the end of the course. And fourth one, review at the end of the course. Fine. Then what else you can talk about this one is, you see here, yeah, here, this one, this is ulcer daily saline dressings. Ulcer daily saline dressings. Okay, they were provided. And a review healing process. So review healing process. So you can take this one. Observe signs for complications. You can take this point. Observe for signs of complications. So regular monitoring. You can say. So monitor. Okay. Monitoring signs of complications. Okay. Wound complications. Wound complications. Okay. Monitoring. So regular monitoring unit. So these are the sentences you can write here. These are the sentences you can write here in the first paragraph. Okay. That's it. So this is it. So this is main body paragraph 1. So that you can write. Now main body paragraph 2 is here. Main body paragraph 2. What you can write in main body paragraph 2? So you can talk about his different things. Okay. So his work, his retirement. First one is retirement. You can see here. Okay. You can see here very clearly. First one is retirement. So focus on retirement, right? Focus on retirement. Then what else? Focus on retirement. And now what else we can talk about her here is income, small pension. So very meager salary. Small pension means meager salary. You can talk about that one. Again, talk about that one. And then nobody is there. Lonely, loneliness. Nobody. Alone. Lives alone. So nobody is there with her. Nobody is there with her. She's all alone. Fine. Nobody to bother about her. So you can write about that. And income is decreased since retirement. You can see there. Income is after retirement, pension. She lives on a pension and she has no interests. Okay. She has no activities. She is not participating in any activities. So that is what you can write about herself. And then what else? Right. Other than that, nothing is there. So we can also talk about this one. Since retirement, alcohol intake increased and dietary quality decreased. Alcohol consumption increased and dietary quality decreased. So the next one, she has periodic problems with self-administration of hypoglycemic medication. Okay, she has problems. She has problems with administration of hypoglycemic medication. So you can see all these points. So these points will go into the second paragraph. These points will go into the second paragraph. Now, third paragraph. So you have to write about monitoring, regular monitoring of number one, medication compliance, monitoring blood sugar levels, alcohol consumption, and dietary regimen. 4 things: medication compliance, blood sugar levels, alcohol consumption, and diet. You have to monitor all these things, 4 different things. Then in addition to that one, encouragement is required regarding exercises. Okay, and that should be moderate exercise regimen. Okay, moderate exercise program. The next one, you should establish, okay, establishing an income generating activity or program is necessary because she has to survive. The enough money is not enough, so she has to participate in some income generating activity, some activity where she'll get some money so that she can sustain herself. And next one, other than that, establishment of social activities. Okay, so she's not participating in any social activities. She is lonely, and afterwards she will face some problems, maybe because of nobody is there to talk to her. So social activities like quiz and club activities or something. Okay, charity activities, something like that. That should be done. And now prepare a letter to the community and the need for an overall lifestyle plan. So this overall lifestyle plan also is needed. Okay, overall lifestyle plan. You're already writing the letter. So overall lifestyle plan, okay, lifestyle modification. Then involvement of community social worker also is needed because, okay, community social worker is needed. So she should be involved in treating this particular patient. Okay. So now you understand all the important points we have got. Okay. So whichever is there, you can manage like this one and you can write. Now, I want to ask you, do you want to learn how to write sentences? Okay. Now I'm asking you one sentence. Do you want to learn how to write quality sentences? Okay. So if at least 5 people are there, yes, then I'll give you. At least 5 people are there, yes, then I'll give you. Okay. Come on, let us start with the introduction then. How many people have said yes? So Okay, folded edge, yeah, more than 5 are there. Yeah. So now first let us start with introduction. First, let us start with introduction. So Sheila Cartwright, sentence number 1. Now sentence number 1. Sentence number 1. Introduction. Introduction. What all you can write in introduction? Number one is you have to write Sheila Cartwright, the name of the patient. Okay, Sheila Cartwright. That is number 1. And this is Miss Sheila Cartwright. Okay. Number two is okay. So admission. So no, what is not admission? You can say right, the purpose, the present condition. The present condition is unstable diabetes mellitus. Unstable diabetes mellitus. Okay. Okay, fine. Unstable diabetes mellitus. And the second problem is, that is number 3, that is small infected, okay, left foot ulcer. That is the third one. You have to add this one also. Now number 4. Okay. Number 4, purpose. What is the purpose? She requires what? Requires what? Requires regular monitoring. And the fifth one is appropriate management. Okay. So these are the things which you can write. Mishira Cartwright, unstable diabetes mellitus, small infected left foot ulcer requires okay, regular monitoring, appropriate management, all these things. Come on, write down your introduction. You can write down your introduction. I have given you the clues. I have given you the points. Yeah, you can write the introduction using these things. And next one, number 6 is discharge. And discharge today. These are the points which you can use. Come on, I'm giving you 3 minutes. Yeah. Yes. Okay, very good, very good. Miss Sheila, who was diagnosed with unstable diabetes mellitus and a small infected left foot ulcer, is being discharged today. Appropriate management and regular monitoring is required. Fine. Following the discharge today. Okay, fine. Miss Reela Cartwright, who has been diagnosed with Lakshman with unstable diabetes mellitus and a left foot ulcer, requires ongoing care and lifestyle modifications from your service following the discharge today. Good. Come on, come on, come on. We'll move into the next paragraph. Okay, Jennifer. And a small infected left foot ulcer. A small ulcer. Okay. Right. Come on, come on. Then we'll go to the second paragraph. Each sentence we'll see. Yeah. Yeah, Jennifer. Okay. So it'll take 1 minute more. Okay. Reena Saini. Miss Sheila has been diagnosed with unstable. Better to write who was diagnosed with. Okay, who was diagnosed with, not who has been. Who was diagnosed with. Diagnosis is one time. Finished. So who has been means present, but it's long time since. So present perfect or past tense, but past tense is better. Right. So now next point you'll write about what? Yeah, you'll write about so this is the first paragraph. Okay. Stabilization of diabetes mellitus. Stabilization of diabetes mellitus. Treatment with glum. So she was admitted for what? when, date. So, okay. She was admitted for stabilization. 30 April 2017. 30 April 2017. Okay. So admission. Okay, 30 April. 30 April 2017. So this is how you can write. Okay. So the paragraph is there here. You can take. Fine. So write about the first sentence. So on 30 April 2017, she was admitted. Who was admitted? Miss Cartwright was admitted for stabilization of diabetes mellitus. And she was treated with glibenclamide and metformin. So what type of agents are there? They are anti-hypoglycemic agents. Anti-hypoglycemic agents. Okay. Glibenclamide and metformin. Write down your sentences. No need. It's normally you can write, no worries. So as usual, however you want to write, you can write Miss Cartwright. That's all. Miss Cartwright. Yeah. So I'm teaching you different sentences. Okay. Now, let us take a sentence. For example, you can take sentences. For example, how you can take the sentences. Lot of different sentences. So the previous letters, I'll give you some corrected letters. From there, we can take the letters from, okay, Miss Sheila Cartwright. Miss Sheila Cartwright. Okay. So we'll take some. Right. Okay. So you can see here, there are some things which we have given. So this is a discharge letter. Okay. And you have to write with a small infected. Okay. So twice daily. So some corrections again. Adherent to her medications. Okay. Yes, Azubike, very good. So furthermore is a connector using an academic writing. This is a formal letter. So avoid those types of connectors. Moreover, furthermore, like that one. Okay. So she lives alone. Okay. She lives alone. She lives alone. I am referring. So for example, many people write, I am referring. Okay. I'm giving you this one. We're going to learn some sentences. Anyhow, you're going to write the same. Those are different things. But what I'm telling you is I'm going to show you some quality sentences which you can use. Okay, new Word document. Okay, this is. Okay. Word file. Now let us see. I'm giving you some points which you should avoid. So there's a point. Okay. So from the previous letters which I have corrected, I'm giving you some points. Okay. Let us consider these points. So now, so this is a discharge letter. Okay. This is just a discharge letter. They did not say home visits. Whenever she goes there or they come here or whatever it is, everything should be managed by them. Okay. Case notes didn't say, okay, home visits. Case note did it say home visits. You know that this is a discharge letter. Okay, fine. So in the second paragraph, you can write, Miss Cartwright was admitted to the hospital. Okay. Miss Cartwright was admitted to the hospital. This you can write in the second paragraph. Okay. So that is one example. And with a small infected left foot ulcer. Okay. Okay. Right. With a small, okay, left foot ulcer. So she presented with a small, and you can say and dot 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 continuation of and a small infected left foot ulcer, like that you can use complete one. Sometimes instead of and, as some people use as well as, but that is not always managed. Okay, you cannot do everything like that one. Both have different meaning. As well as means in addition to. Okay. Right. So twice daily. What is twice daily? Now let us see here. We'll take the case note here. And twice daily. TDS. What is TDS? 500 mg daily, and this is twice. Okay, BD, augmentin duofort. Augmentin duofort. You should know what are these symbols. TDS means what, BD means what. Now I'll give you the link for that one, so you can check it there. Okay, TDS. So TDS means what? So this is it. These are the points which you can use. Okay, these are the points. These are the words which you can use. Okay, so common abbreviations. Common abbreviations. So right, RX means what? Okay, contraindication, biopsy. Okay, so AC means before meals, OD means once daily, BD means twice daily. So like that one, all the words are given here. Okay, so I'm forwarding them to you. Yeah, these are the words which you can use. And I'm going to post it in our group also. So copy, selected test. Oh. Don't want this one now. Okay, I'll use the tab instead. Copy, WhatsApp, then Mega. Yeah, paste. I pasted in our regular group. Then we have another set. Okay, copy. This also I post there. Yeah, I posted in our personal group. Fine. So you can take it from there. So these are IM means IV means what? IM means intramuscular. IV means intravenous. You have to use it. Okay. You have to use these things very carefully. BD means before dinner. Okay. Okay. BID means twice a day. TID means thrice a day. Okay. So you have to go through these things and you learn. Okay. I'm not sure how far authentic they are, but we have to check that one before that one, because I have got all the things I posted there. Right. So now next one. Since alcohol intake increased and dietary quality decreased. So now how are we going to write this sentence? Okay. How are we going to write this sentence? Okay. Control C. Okay. How are we going to write this sentence? Yeah. So this is the sentence. So now, since retirement, alcohol intake increased and dietary quality decreased. So increased since retirement, comma, increased amounts of alcohol consumption and deteriorated dietary regimen have been noticed. Period. So, since retirement, increased amounts of alcohol consumption and deteriorated dietary regimen have been noticed. Or you can say, increased alcohol consumption and a deteriorated dietary regimen have been noticed or observed or reported. See, however you want to write, try to add those things and try to use those things. Okay, try to use those things. So whenever you take something, how you are writing the sentence is very important. Okay, how you are writing the sentence is important. Since retirement, no need to write every time the name of the patient. Okay, so that's the reason why I write in passive voice. Increased alcohol consumption and decreased dietary regimen have been noticed. So that's it. Okay, this is one sentence. Then what is the other? What are the other sentences that can be used? So let us take from here some quality sentences. Next one. Okay, that is number one. Next one, what we can take. Okay. Okay. Okay, now income, small pension, lower than the pre-retirement income. So this one, let us take this one. Fine. Right. So, now see here, small pension, you can say meager post-retirement pension is survives on. Okay, currently she survives on. Okay. Currently she survives on a meager pension. Currently she survives on a meager pension. Okay. So therefore she requires Therefore, okay, therefore, establishing an income generating activity is recommended. So you can write like this. So you can see here, income generating activity. I'm giving you sentences. I'm not teaching you paragraphs. I already told you how to write paragraphs. Now I'm telling you these things. So suggest, so this one. So I gave you a sentence for this one. Suggest establishment of income producing activity. So this one. So this is the case notes. You can understand how case notes is transformed into sentence. Okay. So then so how to write sentences from the case notes? How to write sentences from the case notes? Right. Okay. Emphasizes the needs for an overall. Emphasizing the needs for an overall lifestyle modification. So let us say this one. Copy text. So an overall lifestyle plan. So how you are going to write this one? Establishing lifestyle modification is advised. Lifestyle modification is advised. Lifestyle modification is advised. Okay. So an overall lifestyle plan. Designing a plan which suits the needs Designing a lifestyle modification plan which meets the personal requirements is advised. So try to write sentences like this. You're not just writing something. Something. अभी बंद किया मैंने ठंड लग रही बोल के अभी बंद किया तो you can see the difference now. Ulcer daily saline dressing. So ulcer daily saline dressing. Let us take this sentence. Okay. Okay. Regular daily saline dressing changes have been provided. Okay, like that. Regular daily saline dressing changes have been provided. I'm just showing you some styles of writing. Okay. You think of which is needed and which is not needed, avoid which is not necessary. But now I'm showing you only sentences, how they can be written. Encourage establishment of social activities. Involvement in social activities like participation, charity, and club programs. Is suggested. Yeah, you can write 101 ways. Anyway, no problem. Only the thing is you have to see how well you are writing. Ultimately, okay. So here there are 4 things. Okay, there are 4 things here. Continuous regular monitoring of medication compliance, blood sugar levels, alcohol consumption, and dietary quality is advised. Okay. Do you think these sentences are beneficial? You can just give your comment, yes or no. If you think they are beneficial, you can say yes. Right. 2 or 3 more sentences, we'll see how to make the sentences. So this, I'm going to make a list now. You don't know how to make a list, so I'm going to make a list now. So suppose this is there. Okay. Now, regular daily saline dressings are required for maintaining the skin integrity. Semicolon. Ongoing monitoring of the wound margins is advised. Signs of complications. Regular monitoring observation and reviewing the healing process is advised. Regular daily saline dressings are required for maintaining their skin integrity. Ongoing monitoring the wound margins is advised. Regular observation for any signs of complications is required, and reviewing the health. Okay. So healing process is advised. There are 4 different things. You can write them separately, or you can make a list of things like this. Okay. So you can check how it is going to suit you. And you can write a prefix and a suffix. That's all. Okay. Then next. So here. Moderate exercise program is encouraged. Moderate exercise program is encouraged. Okay, so all of you can write this letter and submit me. Okay, those who have already written, you can improve the quality and you can practice for yourself. And these sentences, these styles, you can add in every letter. Okay, if you have any doubts, you can ask me. And afterwards, I'll be calling you for a speaking session, one by one. I'll be calling you for speaking sessions one by one. So if you have any doubts, you can ask me. That is the last paragraph, no? Recommendations, what you are telling them to do. There's the last paragraph. Lakshman. Yes, Jennifer, tell me. So that is the end of the session. We can meet. How can I start the fourth paragraph? Okay, following the discharge or upon discharge, following the discharge. You can say what are required following the discharge. Yeah, you can write personal things and his drinking habits and other social life. Whichever is important, you can write. Because you are writing to a community nurse. So that is the end of the session. Have a nice day.